The 3 minutes reading time that you allocated is very important how you use it. Because if you don't use it strategically, then it's going to affect the performance in the consultation. Benjamin Franklin had a quote where it says, by failing to prepare, you're preparing to fail. So this comes down to how you're preparing the case before the consultation starts. When you prepare the case, make sure that you have a process. You know what you're doing in the prep time. So preparation is key. Read the case briefing carefully. Study the patient's case note. Make sure that you take note of any relevant key points. Think about any red flags or any differentials. Jot them down on your whiteboard if you're using a whiteboard, or if you're not, then you can use the IT system and make note on that. Then what I suggest you do is play the consultation in your mind. Anticipate what issues you might encounter and consider what possible solutions and management plan you might need to discuss. The consultation starts before it even happens. By playing it in your mind, you're going to find that when you start the consultation, you're in a better position and the consultation is going to run more smoothly. So let's prime this case together. Let me know what you're thinking when you're reading this, the case briefing. So we can see that this patient was seen by the district nurse, and this district nurse was seeing the patient's wife and then found out that Mr. Robert Jones was not looking well. So the district nurse alerted the GP and also did some observation, which is quite useful for us. Tell me what you're thinking when you're reading this case briefing. So in the case briefing, we don't know the age of the patient, but let's have a look at the case note. So the patient is 67 years old. As you can see, the patient has got some past medical history. So if the patient has got a long list of past medical history, make sure that you read carefully and think about which one are relevant in this history. In this one, essential hypertension, CKD stage 2, the patient is on some medication. Some of them might be an issue if the patient carries on taking them. So for example, ramipril, amlodipine. And we can see that the normal blood pressure has been stable at 142 in the past. But recently on that day, the blood pressure of this patient appears to be quite low. So when you're priming this case, then you're thinking about what are the possible problems in this case. For example, is this patient vomiting? Is this patient able to keep down fluid? Are there any possible causes of diarrhea? It could be gastroenteritis or diverticulitis. Maybe the patient is at risk of dehydration. There's a risk of AKI on CKD. You might consider whether you want to stop ramipril and amlodipine. Think about the red flags that you might want to ask, and explore the idea, concern, expectation as well. So in this situation, if the patient is also carer for the wife, they might be reluctant to be admitted in hospital. Then in your management, how are you going to readdress that? And what alternative management are you going to offer? So think about the psychosocial, the situation. Priming is really important, and the 3 minutes reading time is key. Once you've done that, then you have 12 minutes to consult. In the consultation, when you have already played out the consultation in your mind, then your thoughts are going to be more organized and you will know exactly what is your game plan in the consultation. And then you might be able to make a better plan if you've done the groundwork of thinking it through beforehand. So what is the purpose of the SCA? The purpose of this exam is to see whether candidates are able to keep patients safe, that you're able to work at a level that is safe, and you're showing that you're as an independent GP. That's the level that we're looking at. And it needs to be showing that you're able to adapt the way that you're treating different types of patients and illnesses, and also about managing risk, how you're managing risk, medical complexity, and managing uncertainty. The examiners are also looking at how you're exhibiting appropriate behaviors, attitudes, and concerns for the patients that you've got or the simulators. So it is a behavioral assessment. So if you're not saying something, the examiners won't be able to read your mind. So it needs to be verbalized. So there are 12 clinical experience groups that have been decided, as in what are the cases that you might get. So you will get a case in each of these 12 clinical experience groups. It's key that you identify which are the areas of weakness you might have. Typically, for male GP trainees, they might struggle with gender, reproductive, and sexual health because they might not have a lot of exposure in that. Other cases that might be a struggle for GP trainees are the cases involving professional conversation and professional dilemma. So these are cases where it can be difficult. For example, if you're discussing with another healthcare practitioner about something that's quite difficult. For example, let's say that you've got another doctor who is consulting you about their health problem, and they might have some problem with alcohol dependence. And that's going to be very challenging. Or you might have a new patient who is diagnosed of HIV and they don't want their partner to know about it. So there is a professional dilemma here. So think about what case scenarios that might come up, and if you're thinking about these scenarios and practice them, then it's going to be good preparation for you, because you don't want to be doing it in the exam first time. You want to have already practiced these types of scenarios.